Today we are going to discuss about calcium, its diagnosis and its deficiency disorders. Calcium is a naturally occurring mineral that is an essential component of the human body. It is absolutely necessary in order for all the system of the body to function properly. 99% of the body's calcium is in the bone and teeth, where it plays two roles. First, it is an integral part of the bone structure, providing a rigid frame that holds the body upright and serves as attachment points for the muscles, making motion possible. Second, it serves as a calcium bank, offering a readily available sources of the mineral to the body should a drop in the blood calcium occur. Most of the calcium in the human body is found in bones and teeth. There is a complicated regulatory process that keeps the body levels of calcium stable when a person is in good health. This involves the absorption of calcium from food, the storage of calcium in bone, the elimination of excess calcium in the urine, and the reabsorption of the calcium into the blood from the bone. If levels get low, a number of hormones and vitamins help regulate this process. The main hormone is called parathyroid hormone, and it is necessary for the body to maintain a normal calcium level. Vitamin D is also essential for the body to absorb and use calcium. For most people, the level of calcium in the blood stays normal and nerves causes a problem. Many people develop a deficiency of calcium in the bone as they age. They have not been ingesting enough calcium in their diet for years, and the body has used the calcium from bones to keep the levels up. People low on calcium will have lower bone mass as well as a deterioration of bone tissues. This is called osteoporosis. As bones begin to form, calcium salts form crystals called hydroxyapatite on a matrix of the protein collagen. During mineralization, as the crystals become denser, they give strength and rigidity to the maturing bones. As a result, the long leg bones of children can support their weight by the time they have learned to walk. Many people have the idea that once a bone is built, it is inert like a rock. Actually, the bones are gaining and losing the minerals continuously in an ongoing process of remodeling. Growing children gain more bone than they lose, and healthy adults maintain a reasonable balance. When withdrawals substantially exceed deposit, problems such as osteoporosis develop. The formation of teeth follows a pattern similar to that of bones. The turnover of minerals in teeth is not as rapid as in bone. Fluoride hardens and stabilizes the crystals of teeth, opposing the withdrawal of minerals from them. The 1% of the body's calcium that circulates in the fluids as ionized calcium is vital to life. The calcium ion participates in the regulation of muscles contractions, the clotting of blood, the transmission of nerve impulses, the secretion of hormones, and the activation of some enzymes reaction. Calcium also activates a protein called calmodulin. This protein relays message from the cell surface to the inside of the cell. Several of these messages help to maintain normal blood pressure. Calcium may protect against hypertension. For this reason, restricting sodium to treat hypertension is narrow advice, especially considering the source of the DASH diet. In lowering blood calcium as well as in magnesium and potassium. The DASH diet together with a reduced sodium intake is more effective in lowering the blood pressure than either strategy alone. Protective relationship between dietary calcium and blood cholesterol, diabetes and colon cancer is also exist. Calcium homeostasis and calcium may also plays a very important role in maintaining a healthy body weight. Relationship between calcium intake and body fatness, as well as small clinical studies shows the inverse relationship between the calcium intake and body fatness. The higher the calcium intake, the lower the body fatness. Both have the inverse relationship. Calcium from dietary foods seems to exert greater effects on body weight than calcium in supplement form. Calcium intake does not simply reflect a healthy lifestyle. The relationship remains strong even when factors such as energy intake and exercise are considered. An adequate dietary calcium intake may help prevent excessive fat accumulation by stimulating hormonal action that targets the breakdown of stored fat. Calcium homeostasis is one of the body's highest priorities and involves a system of hormones and vitamin D. Blood calcium levels falls too low or rises too high. Three organ systems response: the intestine, bones and last one is kidney. Vitamin D and the hormones parathormone and calcitonin return blood calcium to normal. The calcium in the bone provides inexhaustible bank of calcium for the blood. The blood borrows and returns calcium as needed so that even with the dietary deficiency, blood calcium remains normal. Even as bone calcium diminishes, blood calcium changes only in response to abnormal regulatory control, not to diet. A person can have an inadequate calcium intake for years and suffer no noticeable symptoms. Only late in life does it becomes apparent that the integrity of the bones has been compromised. Calcitonin plays a major role in defending infants and young children against the dangers of the rising blood calcium that can occur when regular feeding of milk deliver large quantities of calcium in a small body. Calcium and calcitonin plays a minor role in adults because of their absorption of the calcium is less efficient and their bones are larger, making elevated blood calcium unlikely. Blood calcitonin is regulated in part by vitamin D and two hormones, calcitonin and parathormone. Bone serves as reservoir when blood calcium is high and as a source of calcium when blood calcium is low. Osteoclasts break down the bones and release the calcium into the blood. Osteoblasts build new bone using the calcium from the blood. Blood calcium above normal results in calcium rigor. It is the hardness or stiffness of the muscles caused by high calcium blood concentration. When the blood calcium below normal causes calcium tetany, is characterized by the uncontrolled muscle contraction, and it is the intermittent spasm of the extremities due to the nervous and muscular excitability caused by low blood calcium concentrations. These conditions do not reflect a dietary excess or lack of calcium. They are caused by a lack of vitamin D or by abnormal secretions of the regulatory hormones. A chronic dietary deficiency of calcium or a chronic deficiency due to the poor absorption over the years depletes the savings account in the bone. The bones, not the blood, are robbed by a calcium deficiency. Many factors affect calcium absorption, but adults absorb about 25% of the calcium they ingest. The stomach's acidity helps to keep calcium soluble, and vitamin D helps to make the calcium binding proteins needed for absorption. Whenever calcium is needed, the body increases its production of the calcium binding proteins to improve calcium absorption. The result is obvious in the case of a pregnant woman who absorbs 50% of the calcium from the milk she drinks. Growing children absorb 50 to 60% of the calcium they consume. When bone growth slows or stops, absorption falls to the adult level of about 25%. Absorption becomes more efficient during times of inadequate intakes. Many of the conditions that enhances the calcium absorption inhibit its absorption when they are absent. For example, vitamin D. Sufficient vitamin D supports absorption, while a deficiency impairs it. Fibers and the binder phytates and oxalates interfere with calcium absorption, but their effects are minor at intakes. Vegetables with oxalates and whole grains with phytates are nutritious food, of course, but they are not useful calcium sources. The margin present factors that influence the calcium balance. The human body does everything it can to keep the amount of calcium in the blood within a normal range. If enough calcium is not ingested in food or supplements, the body will start pulling calcium out of the bones. It will also allow less calcium to leave the body in urine. If all the hormones in the body are working properly, including a high enough level of vitamin D, the level of calcium in the blood will be normal. A low calcium during the growing years limits the bone's ability to reach their optimal mass and density. Most people achieve a peak bone mass by their late 20s, and dense bones best protect against age-related bone loss and fractures. All adults lose bone as they grow older, beginning between the ages of 30 and 40. Should bone losses reach the point of causing fractures under common everyday stresses, the condition is known as osteoporosis. You can see here the active growth phase occurs from birth to approximately age 20. The next phase of peak bone mass development occurs between the ages of 12 and 30. The final phase, when bone resorption exceeds formation, begins between the ages of 30 and 40 and continues through the remainder of life. One cause of hypocalcemia, which means low calcium in the blood, is hypoparathyroidism. This means the parathyroid glands are not working properly. The parathyroid glands are in the neck or either side of the thyroid glands, around the level of the Adam's apple. The parathyroid glands can be removed accidentally during the thyroid surgery. They can be infiltrated by cancer. There are genetic conditions that can cause low parathyroid hormones. There are other problems that affect calcium metabolism. Inadequate level of vitamin D or abnormal levels of magnesium can contribute to low calcium levels. The kidneys also play a role in keeping the amount of calcium in the blood constant. There are many more factors regulating calcium level in terms of other minerals, cofactors and vitamins. A person with a calcium deficiency may experience muscle cramps and spasms, pain in the thighs and arms when walking or moving, numbness and tingling in the hands, arms, feet, and legs, as well as around the mouth. These symptoms may come and go, but they do not tend to disappear with activity. More extreme sensations may indicate a more severe deficiency, which can also lead to convulsions, arrhythmias, and death. Low level of calciums can cause extreme fatigue, which involves a lack of energy and an overall feeling of sluggishness. It can also lead to insomnia. Fatigue associated with the calcium deficiency can also involve lightheadedness, dizziness, and brain fog, characterized by a lack of focus, forgetfulness, and confusion. A lasting calcium deficiency can cause dry skin, brittle nails, coarse hair, alopecia, which causes hair to fall out in patches, eczema or skin inflammation that can lead to itchy or dry patches, psoriasis. The bones store calcium well, but they require high levels to stay strong. When overall levels of calcium are low, the body can divert some from the bones, making them brittle and prone to injury. Over time, having too little calcium can cause osteopenia, a reduction of mineral density in the bone. This can lead to osteoporosis, which causes the bones to thin and become vulnerable to fractures, as well as pain and problems with postures. It can take years for osteoporosis and other complications of a calcium deficiency. Low calcium levels have been linked to severe premenstrual syndrome, which is PMS, low level of vitamin D and calcium during the second half of the menstrual cycle might contribute to symptoms of PMS, and supplements of the calcium may help relieve the symptoms. When the body lacks calcium, it pulls it from sources such as the teeth. This can lead to the dental problems including tooth decay, brittle teeth, irritated gums, weak tooth roots. Also, a calcium deficiency in an infant can impair tooth development. Calcium deficiency may be linked with mood disorders, including depression. Through confirming who suspect that a calcium deficiency is contributing to the symptoms of depression should consult a doctor. After checking the person's calcium levels, the doctor may recommend a calcium supplement. A person with hypocalcemia can have a change in brain functions. Low calcium can cause the heart muscles to fail. It can also cause arrhythmias, abnormalities in the way the heart beats. A person with very low calcium can have depression, dementia, and even psychosis. If this goes on long enough, there can be swelling in the brain, cataracts in the eye, and permanent heart damage. Very low calcium level can be fatal. Calcium is very necessary for many critical body functions and cell functions. Of the body's calcium, 99% is in bone. 1% is not in bone, but it is present in blood, other body fluids, inside cells, and inside certain parts of cells. The amount of calcium in cells is tightly regulated. Calcium goes in and out of the cell through the cell membrane and parts of the cells, called organelles, including the mitochondria, the so-called workhouse of the cell. Calcium acts as a messenger. It is involved in cell-to-cell signaling. It is a part of neural transmission. The signals from nerve to nerve. It is necessary for normal muscle function, including heart muscles. Part of the blood coagulation system, it is the cofactor for many enzymatic reactions and the activation of other messengers. It is involved in secretions of many chemicals, including hormones. It is critical in the mineralization of bone. Calcium mechanism of action are multiple and complicated. It is mainly important to know that calcium has to be present in the correct amount for the nerves and muscles to talk to each other and work as they should. This includes everything from thinking to moving. Calcium needs to be present in enough quantities to give strength to the bones. As children grow, bone is growing with them and needs enough calcium to be strong. Bone is constantly being remodeled, meaning damaged bone is cleaned up and new bone is deposited in its place. A lack of calcium at any time can cause weakened bone. Up until around age 30, more bone is made by cells called osteoblasts, then removed by the cells called osteoclast. The body eventually shifts to removing more bone than forming new bone. Calcium in the body is also related to the amount of phosphate, magnesium, and other chemicals. It is tightly regulated by a number of hormones, including testosterone or female hormones, vitamins, factors, receptors, all of which interact to keep the blood calcium level normal to get enough calcium to the bone. This can come on gradually or be a medical emergency. It is not from a lack of dietary calcium, but from malfunctions of the complicated systems that controls the level of calcium in the blood, usually because of low parathyroid hormone. It can also be from a severe lack of vitamin D if all the systems controlling calcium in the blood are working. Calcium will be pulled out of bone to keep the blood level normal. Someone with hyperparathyroidism will be low on calcium and supplementations will be necessary for life. In this situation, low amounts of calcium in the blood can be fatal if not treated. For preventing the osteoporosis, calcium, along with vitamin D, exercise, and other factors, can help prevent the osteoporosis in older men and women. Many people do not get the recommended amounts of calcium as teenagers and young adults. Does that make them more likely to develop osteoporosis later in life? Bone mineral content and size can be increased in boys 16 to 18 by giving them supplementary calcium. Similar recommendation can also be given within the age of 16 to 18 years old girls. Bone mineral density increases in children who get more calcium in their diet or have supplements. This effect disappears when the supplements are stopped. It will be some time before anyone can say with certainty that starting supplemental calcium at a young age will increase bone strength, going into middle age and give more of a cushion before development of osteoporosis. It seems reasonable to think this might be the case. It also seems unlikely that most people will take supplemental calcium all of their lives. People with osteoporosis need treatment with calcium, vitamin D, and often medication in order to prevent the fractures. Fractures in people with osteoporosis can often occur with minimal or no trauma. They can also be serious enough to cause the serious decline of an older person. As many as 25% of people who sustain a hip fracture wind up needing long-term care in a nursing home. Of patients over age 50 who have a hip fractures, about 24% of them die during the year after their fracture. Osteoporosis usually becomes evident in women after menopause and in men more slowly as they age because testosterone as well as estrogen affects the amount of calcium in the bone. More bone is resorbed by osteoclast and less is replaced by osteoblast, especially if there is not enough calcium and vitamin D around. There is not complete agreement as to when to screen for osteoporosis, who to screen or who to treat. Women are assessed premenopausally for osteoporosis. Recommendation that women be screened at age 65 or 60 to 64 if they are at higher risk for osteoporosis. Risk factors in women include low body weight, low level of physical activity, excessive alcohol intake, caffeine and tobacco use, low calcium and vitamin D intake, no hormone therapy for menopause, increasing age, history of falls, family history of osteoporotic fracture, personal history of fracture, white or Asian background. Some of the same risk factors apply to men. There are also many illnesses and medications that can cause osteoporosis in men and women. Illnesses include but are not limited to autoimmune diseases like rheumatoid arthritis, lupus, inflammatory bowel syndrome, and kidney failure. Endocrine abnormalities can cause osteoporosis, including diabetes, hyperthyroidism, hyperparathyroidism, and hypogonadism among adults. Glucocorticoids, immunosuppressants, and medications that suppress the sex hormones are some of the more common medications that can cause osteoporosis. The way to check for osteoporosis is with a special X-ray test or DEXA scan, which means dual energy X-ray absorptiometry, usually checked at the hip and spine. Bone density is compared to the bone density of healthy young women. If a test is significantly lower, osteoporosis is present. The results are expressed as how far a test differs from the reference value. This number is called a T-score. What patient need to know is that a T-score of -1 to just under -2.5 means the bones are thin, called osteopenia. When the T-score is equal to or below -2.5, it means osteoporosis. There are calculations that can be made to get an idea of the risk of fracture based on a person's DEXA score and other factors. Treatment decisions are usually made on the basis of DEXA score, history of hip or vertebral fracture, and risk of fracture based on the number of criteria. The World Health Organization recommends the treatment based on a low DEXA score, less than or equal to -2.5 at the hip or spine, or if the person has sustained a hip or vertebral fracture, or if the DEXA scan is not as low but there are lots of risk factors for patients. Treatment of osteoporosis involves many things, which is the part of the treatment of osteoporosis. Calcium is the part of the treatment of osteoporosis along with the vitamin D and the number of the medications that can help strengthen the bones. Calcium supplements should be split up during the day and not taken all at once if possible. Adults with osteoporosis need to ingest at least 1200 mg of calcium plus vitamin D. It is important to remember that each person need to take that much elemental calcium. Calcium carbonate is 40% elemental calcium. Calcium citrate is 21% elemental calcium. There are two most commonly used supplements. Calcium carbonate is not well absorbed and must be taken with meals. Stomach acid must be present to absorb it. Calcium citrate does not need to be taken with meal and is more completely absorbed. Calcium can decrease the absorption of many other medications, including some medications for high blood pressure, some antibiotics, and some of the medications used to treat osteoporosis. Most forms of the calcium can cause gastrointestinal side effects, including gas, cramps, bloating, and constipation. Calcium citrate causes these symptoms somewhat less often than calcium carbonate. When starting supplementation, sometimes beginning with the low amount and increasing it slowly may reduce some of these symptoms. If the gas and constipation are problem while taking calcium carbonate, a switch to citrate may help. Sometimes just taking a different brand of calcium supplement helps. Hypercalcemia or too much calcium in the blood is caused by disorders in the body and not overdoses of the calcium. This has been covered under the primary usage because it is a fact. A 1 year study of young healthy women did not detect any difference in weight when the women were given the same number of daily calories but in calcium rich dairy products. In another study, calcium supplements or placebo were given to the premenopausal and postmenopausal women on calorie restricted diets for 25 weeks, and there was no difference in weight loss or fat mass decrease between the groups. A recent study designed to see if calcium supplements would prevent overweight women from gaining weight showed absolutely no benefit to the supplements. Coral calcium from ocean coral contains calcium carbonate, just like terns or other chewable antacids, but at a premium price. It does contain other biologically active ingredients, magnesium, and for example, also contaminants like lead some of the time. Consumers should be aware that claims that coral calcium can treat or cure cancers, multiple sclerosis, lupus, heart diseases, or high blood pressure are not supported by the existing scientific evidence. These claims go far beyond the existing scientific evidence regarding the recognized health benefits of the calcium. What was in a number of coral calcium supplements was looked. Some of the coral calcium bottles did not have the amount of the calcium stated. Some of it was in a form that was hard to digest, and some had elevated lead levels. In addition to the high price and contamination, coral calcium promotes continue to make false claims about their product curing cancer and many other illnesses. In a large study, more than 36,000 postmenopausal women were randomly assigned to receive the calcium and vitamin D or placebo and were followed for 7 years. There was no difference in coronary or cerebrovascular adverse events. These findings predated as observational studies looking at results of the trials of the women ages 60 to 89 given the calcium and vitamin D found that they did not have any higher risk of cardiovascular events or deaths than women not given the supplements. It is not possible to state with certainty either way. It seems that perhaps calcium with vitamin D may be safe. Women in these age groups who are at risk for both osteoporosis and heart disease need the choices with their physicians. Do you ever think, does increased calcium increase the risk of prostate cancer? This question has not been answered. High risk of prostate cancer have found a very slightly increased risk. The decreased incidence of colon polyps associated with the increased calcium intake has been showed to last at least 5 years. One recent study found evidence of the decreased distal colon cancer with the increased calcium intake, enough to encourage the further researches. Other many researches have found similar results. Some studies have shown a reduced risk of all cancers, but especially the intestinal tract. Another study of postmenopausal women given the calcium plus vitamin D, or placebo found that calcium plus vitamin D reduces the risk of cancers over 4 years. The effect was most apparent in the women given both calcium and vitamin D. There are countless areas to explore, as all the functions of calcium, especially in conjunction with vitamin D, calcium and vitamin D probably together exert their effects on many more body systems than was originally believed. It is very important to ensure proper calcium intake at all ages. For children and teenagers, the recommended daily allowances for calcium and the same for both genders. Children with the age of 9 to 18 years, the RDA for calcium is 1300 mg. And for the children with the age of 4 to 8 years, the recommendation is 1000 mg per day. And the children with the year of 1 to 3, the recommendation is 700 mg. And the children with the age of 7 to 12 months, the recommendation is 260 mg. And the children with the 0 to 6 months, the recommendation for the calcium is 200 mg. For the women with the age of 71 years and up, recommendation are 1200 mg per day. And women with the age of 51 to 70 years, the recommendation is 1200 mg. Women with the age of 31 to 50 years, the recommendation is 1000 mg. And the women with the age of 19 to 30 years, the recommendation is 1000 mg 2 per day. And the men with the age of 71 years and up, the recommendation is 1200 mg. And the men with the age of 51 to 70 years, the recommendation is 1000 mg. And the men with the age of 31 to 50 years, the recommendation is 1000 mg. and the men with the age of 19 to 30 years, the recommendation is 1000 mg. Women need to increase their calcium intake earlier in life than men, starting in middle age. Meeting the necessary calcium requirement is particularly important as if women approaches to the menopause. During the menopause, women should also increase their calcium intake to reduce the risk of osteoporosis and calcium deficiency disease. This decline is in the hormone estrogen during the menopause causes a woman's bone to thin faster. The hormone disorders parathyroid hormone may also cause calcium deficiency disease. People with this condition don't produce the enough parathyroid hormones which controls the calcium level in the blood. Other level of hypocalcemia include malnutrition and malabsorption. Malnutrition is when you are not getting enough nutrients, while malabsorption is when your body can't absorb the vitamins and minerals you need from the food you eat. If you miss your daily dose of calcium, you won't become calcium deficient overnight. But it is still important to make an effort to get enough calcium every day. Since the body uses it quickly, vegans are more likely to become calcium deficient quickly because they don't eat calcium rich dairy products. Calcium deficiency won't produce short-term symptoms because the body maintains calcium level by taking it directly from the bones. But long-term low levels of calcium can have serious effects. Always contact your doctor if you have symptoms of calcium deficiency disease. They will review your medical history and ask you about your family history of calcium deficiency and osteoporosis. If your doctor suspects calcium deficiency, they will take a blood sample to check your blood calcium level. Your doctor will measure your total calcium level, your albumin level, and your ionized or free calcium level. Albumin is a protein that binds to the calcium and transports it through the blood. Sustained low calcium level in your blood may confirm a diagnosis of calcium deficiency disease. Normal calcium levels for adult can ranges from 8.8 to 10.4 milligrams per deciliter. You may be at risk for calcium deficiency disease if your calcium level is below 8.8 mg per deciliter. Children and teens typically have higher blood calcium levels than adults. Neonatal hypocalcemia occurs in infants soon after birth. Most cases of neonatal hypocalcemia occur within the first 2 days after birth. But late onset hypocalcemia can occur 3 days after birth or later. Risk factors for infants including being small for their age and maternal diabetes. Late onset hypocalcemia is most often caused by drinking cow's milk or formula with too much phosphate. Calcium deficiency is usually easy to treat. It typically involves adding more calcium to your diet. Do not self-treat by taking a lot of calcium supplements. Taking more than the recommended dose without your doctor's approval can lead to serious issues like kidney stones. Commonly recommended calcium supplements include calcium carbonate, which is the least expensive and has the most elemental calcium, and calcium citrate, which is the most easily absorbed. Calcium phosphate, which is also easily absorbed and does not cause constipation. Calcium supplements are available in liquid tablet and chewable forms. It is important to note that some medications could interact negatively with the calcium supplements. These medications include blood pressure beta blockers like atenolol, which may decrease the calcium absorption if taken within 2 hours of taking the calcium supplements. Antacids containing aluminium, which may increase the blood levels of aluminium. Cholesterol lowering bile acid, such as cholesterol, which may decrease the calcium absorption and increase the loss of calcium in the urine. Estrogen medications, which can contribute to an increase in calcium blood levels. Dixosin, as high calcium levels can increase the dixosin toxicity. Diuretics, which can either increase the calcium levels or decrease the calcium levels in the blood. Certain antibiotics, such as tetracyclines, whose absorption can be decreased by the calcium supplements. Sometimes diet changes and supplements are not enough to treat a calcium deficiency. In this case, your doctor may want to regulate your calcium levels by giving you regular calcium injections. You can expect to see results within the first few weeks of treatments. Severe cases of calcium deficiency disease will be monitored at 1 to 3 months interval. You can prevent the calcium deficiency disease by including calcium in your diet. Be aware that foods high in calcium, such as dairy products, can also be high in saturated fats and trans fats. Choose the low fat or fat free options to reduce your risk of developing high cholesterol and heart diseases. You can get one-fourth to one-third of your RDA of calcium in a single serving of some milks and yogurts. While meeting your calcium requirement is very important, you also want to make sure you are not getting too much. You might want to supplement your diet by taking a multivitamin, or your doctor may recommend supplements if you are at high risk for developing a calcium deficiency. Multivitamins may not contain all of the calcium you need, so be sure to eat a well rounded diet. If you are pregnant, take a prenatal vitamin. Vitamin D is important because it increases the rate calcium is absorbed into your blood. Ask your doctor how much vitamin D you need. To increase your calcium intake, you can add food rich in vitamin D to your doctor. These include fatty fish like salmon and tuna, fortified juices, fortified milk, eggs. As with calcium rich dairy products, some vitamin D rich dairy products can also be high in saturated fat. Sunlight triggers your body to make vitamin D. So, getting regular exposure to the sun can also help boost your vitamin D levels. In addition to maintaining the healthy calcium and vitamin D level, there are certain lifestyle changes you can make to promote bone health. These include maintaining a healthy body weight, exercise regularly, restricting tobacco use and alcohol intake. They say that milk can give you stronger bones and healthier teeth, but many other foods are good sources of calcium. Try adding more of these to your grocery list: yogurt, dairy products, nuts and seeds, beans, broccoli, spinach, figs, oranges, salmons,